So really what we're going to do in a short 8 minutes is talk about colon screening and really what it is, why we should all have it when we get to our turn, because it's in fact one of the more preventable cancers that we have if we do it right and early enough. So colon cancer, it's that black thing, it's sort of that shadow in the colon, things that people don't really want to think about. People generally only think if they see blood there's going to be something there, and as we're going to find out in the next few minutes, that's far from the truth. So what symptoms do people present with? Well, people think of rectal bleeding, if they're told they're anemic, if they have abdominal discomfort, if they have a change in bowel habits. Those are some of the symptoms. But most people don't have any. So it's just something that's there and they're unaware. And that's the big problem that we have. So how do you know you have it? Really, most of us don't know whether we have it unless we get screened or checked. Frankly, if we're lucky, we get symptoms early, and that actually gets us to the doctors earlier. Lots of famous people have it. It doesn't matter who you are, it just comes. And so we didn't put up all the pictures of all the famous people that have it, but everybody knows someone, and everybody knows someone who has it or has had it. It happens to be the second most common cause of cancer death in the country. So it's not something insignificant. It's second only to lung, more than breast, and more than prostate. New cases seems to be, for the most part, age dependent. And you can see the curve changes at around the age of 50, and that's why most of the screening programs in the country use the age of 50 for our starting point. It doesn't mean we'll get because there's people who will always have things early in life, and you wouldn't start programs for that. But at 50, if you haven't been screened, you should think about it. Most people think, oh, I don't have it. I don't know anybody who has it. My uncle didn't have it. My father didn't have it, so I don't have it. Well, most people don't have any. 75% of people, it's what we call sporadic, or it just happens, and we don't have any predetermined risk for it. Everybody after us will have a predetermined risk, but not before us, if you're the first person. There's family history is 15 to 20%, and then some rare disorders, including inflammatory bowel disease, that increases risk. So why should we get tested? Everything's working. My bowels are fine. I don't feel fine. Why should I go to the doctor? Why do I want to have one of those bad tests? Why do I have to look in the toilet? Or why do I have to have something put up my rear end? I don't know, but the fact is that's what prevents colon cancer or finds it early. And so we have to really get over, unfortunately, the negative aspects of what we're talking about and get screened. In the past 20 years, there's evidence from every procedure that we do that it saves lives. Whether it's stool testing, endoscopy, or new tests, they all save lives, and the important thing is to get one of them, okay, regardless of which one you get. So there's fecal tests. Currently in Ontario, we do a fecal called blood testing. We collect 3 cards. Everybody gets a letter when they're 50. If you haven't got one, you go speak to your family doctor. Over the next few years, we're transitioning to a new test called an FIT. It's a better test, also a stool-based test. So probably within the 3 years, everybody in the province who gets the letters with those kits will get new kits in this province, and many other provinces in the country already are doing these FIT tests. There's nurse sigmoidoscopy programs in Ontario that have been trialed. Lots of colonoscopy is being done. It's not part of our provincial program per se. It's more opportunistic, or we're being referred to it. There's these new blood tests that we're not sure what place they have yet in our screening armamentarium, and there are people getting CT scans and specific CT scans that can show the image of the colon. And there's probably some other tests out there, capsule endoscopy, and a few other things that people have tried or are using. So just quickly about the difference between the 3 primary tests that people will see. So the FOBT, or the stool-based test, you sample stool and look for blood in the stool. Sigmoidoscopy is a short telescope test that goes up, a third of the colon and looks for these little bumps, or things are called polyps. The colonoscopy looks at the entire colon and can find those polyps or cancer no matter where it is in the colon. So those are the different tests. I just put up screening programs. I don't know who's here from where you're from, but across the country, most provinces now either have provincial screening programs or developing provincial screening programs. For the most part, they're now all transitioning to the FIT programs. Ontario isn't, we were the first one out, but we're transitioning over the next number of years as we change it. But moving a provincial program takes a little while. The important thing in Ontario, since that's probably where most people are from, is if you're 50 or over and your average risk, you should get at least a stool test if you and your family doctor don't talk about any other test. But if you're at increased risk, so a first-degree family member, many family members have it, colon cancer or polyps, then colonoscopy would be what you do. Or if you have a positive FOBT test, you would need a colonoscopy. So what can you do? You can get screened. If you haven't been screened, it's never too late. Talk to your family practitioner, and if there's family members that had cancer when they're young or lots of polyps, then you may even need to start earlier. Thanks.